Now I will say, good morning, everybody. I would like to call to order. Am I really loud? I sound really loud. I'd like to call to order the Public Health Committee meeting for this Tuesday, December 17th, 2024. Please call the roll.
Juby,
Juby here.
Hennessis,
Hennis is here.
Carver,
Carver's here.
Young,
Here.
Sanchez,
Sanchez present.
Strathman.
Strathman here. Okay, and I would like permission to have Tarver and Sanchez join us online. Is that okay with it?
Mhm.
Okay.
Sounds good.
Okay, welcome. Good morning, you guys. And I'd like to say that today in history was the day of first flight. December 17th, 1903, the Orville Wright brothers, or Orville Wright, the Wright brothers.
Orville and Wilbur.
Are you
Sorry.
okay? Are you okay?
My wife loves that ringtone. That is why I have it. She
Okay,
doesn't really.
okay,
That is-
but you're okay.
Exactly. Sorry.
You got our, well, we're all awake now. So we, next, I would like to ask for unanimous consent or unanimous approval of the minutes from November 2024.
I'll move to make unanimous consent for the approval of the minutes for last month.
Thank you, David. Okay, and do we have any public comment today?
Yes. I
David?
meant to sign up, but I left. I didn't leave. Get this.
I think we're doing it a little casual this morning, so no worries.
Okay, good. Okay, David Young, good morning. I just wanted to bring up the vaccine adverse event reporting system that is actually data collected from the CDC website. And if you go to the Kane County Health Department website, they do have the VAERS. Well, they have VAERS on it, but you have to do a search for the VAERS on the Kane County Health Department website. I request that this information that I'm going to provide you, which gets updated periodically, gets placed where the immunizations tab is on the Kane County Health Department website. Because, and at that location, that's where the Kane County Health Department is advocating for immunizations, but I think they should also be educating the people as to what exactly could occur from these vaccines. So I'm just going to quickly go through a couple of statistics reported by what they call the Vaccine Adverse Event Reporting System from the vaccines, the COVID-19 vaccines. So to date, over 38,000 deaths, over 219,000 hospitalizations, 28,000 cases of myocarditis and pericarditis, over 17,000 cases of Bell's palsy, over 5,000 miscarriages, over 22,000 heart attacks, over 72,000 permanently disabled, and much, much more. So again, This is information this is public information that it's extracted from the CDC. This needs to be on the Kane County Health Department website, and the best place for it would be right at the immunizations tab. Thank you.
Thank you. We don't have anybody online to, that was it. Okay. The financial reports are in your packet. Do we have any questions about them? Okay. And then my apologies to Mr. Youngstead. I did not remember to call him, so he is joining us online this morning. So good morning, Brett.
Good morning, everyone, and I apologize. I had a box of kittens outside today that also has me thrown, so we're dealing with that as well. Always a great morning, especially on a Tuesday. I hope everybody's doing well. All my reports are on file. If anybody has questions, please let me know. I love questions and I love talking about what we do here, so please always find me. Other than that, all I have is the one resolution this month.
Okay. So I would like a motion and a second for the resolution of resolution 23-24-3324 for a donation made to the animal control. So could I have a motion?
Carver would move.
I'll
Barbara will
second.
move. And a second?
Second.
Okay, David Young. Okay, you want to tell us a little bit about this, Brett?
Yes, if I could, please. I have the letter that was sent to us. It was sent to us by Thomas Grant, attorney at law. It
Brett,
says,
is anybody having trouble hearing him?
Yes.
We need you to get
me
either
now?
a little closer or off a speakerphone or something because we're not having a good time hearing you here.
how about now?
Yes.
That's much better, and talk a little slower for us.
Perfect. So,
Okay.
gentlemen, I represent the estate of Sylvia R. Snyder. Specifically, I represent Kenneth E. Olson, the successor trustee of Sylvia's trust. Sylvia died on September 6, 2023. In her trust, she provides for a gift to the Kane County Animal Control in the amount of $10,000. Enclosed, you will find a check in fulfillment of this request. And then it goes into how this gift is unrestricted and can be used for any purposes in connection with animal control. This resolution was sent to the state's attorney, was also sent to finance. We wanted to make sure we did everything correctly. One of the things we're looking to do with this fund is, of course, always give back to the community when we can. One of the things we had discussed pre-COVID, I love that we can say that, was we wanted to put a water fountain for dogs outside our facility. We have this beautiful trail here in Geneva connected to Peck Farm, and tons of people park here. They're able to walk their animals on the trail. We do have poop stations available so that they can clean up after their pets. This would just be another wonderful addition to encourage people to get out and walk with their pets and bond and just be out in nature as it is. It's such a gorgeous path. So we hope to use these funds to put that in. And again, a water fountain for animals is just such a great idea because we do have people that stop in here all the time and say, oh my God, can my dog get a drink? We don't have the ability other than to run and grab a stainless steel bowl and bring it out for them, which we do. I just think this would be such a cute idea. And then to be able to put a little plaque on there, letting other people know that thanks to her wonderful donation, we can give back to the community in such an amazing way and help enforcing that pet-human bond at all times.
Hey, do we have any questions? Madam Juby?
I just have a question. Are we concerned about the transfer of saliva from one dog to another for certain types of illnesses if they share a water bowl?
We've seen this in other locations. I do have a call into the Forest Preserve. I'm waiting to speak with them because we're not the first ones to have this idea. We're not going to be the last. The amount of disease transmission I have seen in my 30 years in veterinary is minimal, if any, because it's the same thing as a dog walking and sniffing another pile of feces on the ground sort of thing. So this will not increase disease transition. It won't be a resource to harbor bacteria. Again, it is the beauty of having it here is it's something we can keep an eye on. We're constantly out there checking our poop station bags. So this would just be another thing on our list throughout the summer to keep an eye on and make sure it's clean and kept sanitary for the animals here.
Thank you.
Thank you for that question and for that answer.
I do share your thoughts exactly, and that's I looked into that and I share exactly what you're saying.
Thank you. Ms. Penesis?
Where are these water fountains going to be located? Or is it one or is it?
It would be a single water fountain, and it would actually be right in front of our facility in Geneva at 4060 Kesslinger Road. We are right next to the big water treatment facility barn for Geneva. It is a great location. If you've never been over here, please, I would love to give you a tour. I'd love to show you around. It's just a great little place in nature. You can come, you can see our solar panels, you can walk the trail. It will be a single unit that's also on camera. So should anything happen, it is fully monitored on our security system here.
Thank you. Would love to visit.
Oh, please.
Hey, any other questions? Okay, please call the roll.
Juby,
Juby, I.
Penisys,
Genesis, aye.
Tarver,
Carver, yes.
Young,
Yes.
Sanchez,
Sanchez, yes.
Strathman.
Yes. Motion passes. Yes,
Um,
Ms. Juby.
I thought I would see him before the meeting. I just have a really quick question about the reports on the biting. May I ask that?
Sure.
Okay, on your bite report, you said total reports received was 56, but I got 9 when I added it up. So what am I missing? I have 3 cats, 5 dogs, and 1 other, but total reports received was 56. Was that 1 dog that bit multiple times?
No, I have to pull that sheet. I will send you the data. I have to find out what I did because clearly
Okay. Okay, I didn't know we just had like a random biter out there that was just,
No.
Okay,
I have a feeling the numbers below are incorrect and I need to find.
okay, thank you. No, it's no hurry. I just
No,
didn't know
no.
if there was like a drive-by biting or something.
Don't ever
Okay.
want that information out there. So I appreciate you catching that and I will make sure that gets fixed.
See, it just shows you, Brett, that we do read your reports because they're so interesting.
It makes me happy. Thank you.
Okay. Okay, any other questions? Okay, thank you, Brett. And again, I apologize for not letting you know about our goofy schedule.
No, my fault as well. Thank you.
Okay, okay. Moving right along, we have another Zoom person this morning in Director Michael Isaacson.
Hey, good morning, everyone. Michael Isaacson, Director at the Health Department. Apologize for not being there with you. I'm feeling a little under the weather, so I'm sequestered in my office, but I'm headed home after this meeting, which brings me to the first thing that I wanted to highlight. It is the middle of December, which means we are right in the thick of respiratory illness season. The combination of the cooler, drier weather, the coming together because it's, well, I don't know, it's going to be 50 maybe on Christmas, but typically coming together because it's colder. We have family gatherings celebrating the holidays that occur this month, and just getting together with children who may be home from school creates a lot of opportunity for respiratory illnesses to spread. So number one, we really want to encourage people to avoid work. I'm just stopped into my office here, but I have not made contact with any people. And like I said, I'm getting out of here. So if you can utilize technology, depending on the type of work you do, we certainly encourage people to do that. And number two, it is really important to stay up to date with vaccines. So both for influenza vaccine and COVID vaccine, they are more seasonal now. So each year, flu vaccine's been like this for a long time, but as COVID vaccine, we're getting the updated strains that are coming. So we do encourage people to get out and stay up to date on their vaccines. Additionally, the only event that I wanted to really highlight is that later today, we are partnering with Age Guide to do an event for seniors, which I promoted last month. I do want to give a big welcome to the new board members being at the first Public Health Committee meeting. Mr. Penisys, glad to have you on our committee. And Mr. Gripe, welcome to the board. Next month, we will do more of an overview of the health department's mission and goals and provide a little additional background. And then I will just make one comment, and I think on our website in terms of the VAERS reporting, as Commissioner Young had pointed out, we do have that on our immunization page. There is the huge caveat with VAERS reporting that the VAERS is step one, meaning If somebody's had a vaccine and they have had somebody have something happen to them, then that gets reported. At that point, it does not necessarily mean that there is causation with the vaccine. So that's the thing that we really want to emphasize. So I can use a lot of different examples for this, but it would be like if we said how many people who buy Ford motor vehicles had a heart attack after they bought their car. Lots of people do, but that doesn't necessarily mean that it is because they bought a Ford, right? So the VAERS reporting is really that first step of gathering information, and it's a very robust system that gathers a lot of information. The next step with the VAERS reporting is where they go in and they look to see with different populations, are these adverse events happening in numbers that are different than what would be a control group or the normal population? So the VAERS is very important information, and we do have it on our website, but we will go back and review it to see if we need to make it more prominent. But it's critically important to point out that that's the initial data collection. It is not definitively saying or even in any way saying that this is because of the vaccine. And so we don't want to confuse people with that issue, but we'll share more information on that. And I certainly appreciate Mr. Young bringing this up because it is important. And when we give people any kind of immunization, whether it's COVID, flu shots, childhood immunizations, we always give people the fact sheets on the immunizations that show what the adverse effects have been in the studies. So, and I don't know, Director Barrett, how long was the COVID for some of the vaccines? It was 10 or 15 pages of information. We want people to make informed decisions. And I can tell you from our reading of the information, whether it's influenza or COVID or any of the childhood preventable diseases, we feel very strongly that the benefits of the vaccine far outweigh the risks. But again, we're happy to continue talking about that because I think it's an important issue.
Thank you.
And with that, we have one resolution for today.
Okay, I would like a motion and a second to authorize resolution 24-3339, authorizing opioid response community implementation project.
Tarver
So
moves.
Tarver moves, and I need a
Juby
second.
seconds.
Who was the second? Juby, thank you. Okay, Michael, you want to tell us a little bit about this?
Sure. This is an exciting part of our comprehensive approach to reducing overdoses due to opioids and other drugs as we start to see increases in our data for some opioids like fentanyl showing up in other things, not just traditionally heroin like it used to be, but unfortunately over the last couple of years, we have seen fentanyl creep into other drugs that people may take, and that's why we so actively are promoting the utilization of naloxone. The board just approved us putting more naloxone dispensing into other buildings around the community because that is a life-saving medication that can be used that's safe and effective to reduce the impact of an overdose. With this particular resolution, what we're looking at, however, is if somebody comes into an emergency department and we can identify that they may have a substance use issue, so they could have come in because it's something drug related, or they just may be in the hospital for something else. But in screening them, we identify they may have a substance use disorder. This is helping to pay for peers who are people with lived experience who can go in and talk to that person and encourage them to take steps to improve their health. So this is something that is highly effective. It's very well researched across the country. If you remember last year, we were one of 5 health departments in the nation that received funding from the National Association of City and County Health Officials to implement This program where we were embedding peers in emergency departments. This is a continuation of that work. This vendor we're working with, Delnor Community Hospital, Northwestern. They were identified through a competitive RFP process, and this is providing $50,000 for them to continue the work that we started building up. This work is not only increasing access to services, but it's also going to continue to provide tremendous data about what they're seeing in the hospitals in terms of our residents who are coming in and in need of services. And that's really important because that helps us so that we can craft and tailor our future interventions to match what's really happening here in Kane County. So I'm happy to answer any questions. And I think Director Peterson's in the room. She can answer questions as well.
Are there any questions? Ms. Juby?
So is this an on-call program or is there somebody there in all of the emergency rooms 24 hours a day?
It's not quite 24/7, but we do try to match it up. We work at the hospital and the person actually becomes an employee of the hospital. So they look at what the volume is and try to match so that the person is there at times when they're more likely to see somebody come in. Part of this is not only when people come into the emergency department, but also there's a benefit of having the person be an employee because then they can work with other floors and even round and find people who may be in the hospital, but not necessarily admitted through the emergency department. So I think to the root of your question, we want to make sure they're there when we need them. And we want to maximize their time so that they're not sitting around with nothing to do. So I think this model that Northwestern is using is a good one where they employ the person. They're able to review charts with the medical team and go and meet with other people in the hospital. But also they're scheduling them so that they can be there when they're more likely to see people with substance use issues coming in through the emergency department. But the simple answer is unfortunately, no, it's not 24/7 coverage.
May I ask a follow-up?
Sure.
So does the hospital generally underwrite this and this is just supplemental payment or is this 50,000 underwriting the whole program?
No,
That seems awfully inexpensive.
Yeah, no, you're right. And this is one of those projects, and this is a model that we use quite a bit with with the Kane County Health Department, where this initiative was the catalyst to get this started. So this will be our last $50,000 infusion into Northwestern, and then they have agreed to underwrite it going forward. Prior to us having this project a little over a year ago, this didn't exist there. And so it was them working together with us through the grant funding we received from NACHO, the National Association of City and County Health Officials. We were actually able to send the head of behavioral health from both Gateway Foundation and Delnor to Maryland to see this program actually in operation in other hospitals. And then when they came back, now they've agreed that with this stipend, and this was part of our original proposal, that then they will support it moving into the future. Because you're right, this $50,000 doesn't cover the cost of it, not even close.
So this is an excellent example of what your whole grant funding system does to seed it, to spark it, it's incredible. I'm so glad it's effective and that they're moving on, and I'm hoping we can continue to do this to their community.
It's very exciting. Thank you.
Mr. Young, did you have a question?
I did. David Young. The third whereas states that there were 230,462 opioid related overdose emergency department visits in Kane County facilities just in 2023. Where did you get that data?
That must be a typo. I apologize. And I don't know. I can look it up. I don't know if Director Alleman or Director Peterson know off the top of their head. But I would guess it's probably 462.
Oh, not the 230 in front of it?
It's not, I don't know, because I think it's more than one a day, I thought was the average. I apologize, Mr. Young. We will get that number and send it out to the committee.
Okay.
Because it's not 230,000, certainly.
Okay. Yeah.
Yeah, sure.
Yeah, because I was looking at this last night and I was thinking, wow, that is a huge
Yeah.
problem. 500,000 people and we have half the people overdosing. Oh my God.
And
So then I went ahead and I couldn't find it. I was trying to find it, but the Kane County Health Department links to the IDPH June 2024 report. In that June 2024 report, I pulled it up, but I found it last night through the Kane County Health Department. But in the Kane, there's a chart that shows there's emergency department visits and there's also emergency medical services. And there's a rolling average for the state of Illinois for emergency department was around 1,500
And
per
these
month.
are drug
Oh,
problems.
no,
that's-
specifically opioid.
Okay, okay.
And
so tell me the
specifically
number again.
opioid visits, not, well, I guess it could be overdose, but these are not deaths. These are opioid visits to emergency departments. And then there's EMS called emergency medical services. And that is around 1,800 a month. So
And this, you said per month.
per month. So we're talking in the state of Illinois, let's say 3,000 per month in the state of Illinois. So that's why when I looked at this number, 230,000, it was just way off. But yeah, if we could
Yeah, and
change that.
I can pull it up, no, and we will correct that. And I have the data here. I don't know, Blair, am I able to share my screen? Because I can pull up what the current data is. If that's okay, I'll just try it and see what, I don't want to mess up the live stream. Is that okay if I share my screen?
He said yes, right? Blair's up.
Okay,
Yeah, go ahead.
okay, very good, thank you. And thank you for catching this, Mr. Young. So what this chart is showing is just over, and this is just updated through 2022. The top chart is showing the number of deaths. I'll zoom in a little bit so it's a little easier for people to see. So we saw a peak in 2021, and fortunately, we are starting to see those numbers come down. I think coming out of COVID and the wide availability of naloxone is certainly contributing. So you can see the number of opioid deaths is dipped down a little bit in 2022. But for what we're talking about here, these are, and there's two ways we look at this data, and you touched on it, Mr. Young. This is opioid-related emergency department visits in Kane County facilities. So that means regardless of where the person's from, right? So this is somebody from Cook County, Kendall County, DuPage County, et cetera. They showed up in one of our 5 hospitals. And you can see since 2020, that number is coming down, which is very positive. And of course, as a nation, we've put a lot of resources into this. So it looks like maybe around 260 is what our number is for 2030, but we'll send the specific number. This is
Excuse me, Michael.
Yeah,
We
go
have
ahead.
We have the exact number from our
Oh.
EPIs. It is 270. So we'll
270.
correct
Thank
that.
you.
Sorry.
Excellent. So we are seeing a slow dip, and then we also analyze, and it takes us a little longer to get the information, but Kane County residents, regardless of which hospital they go to. So if somebody who lives in Kane County, but they overdose in Chicago or in DuPage County and go to a hospital there, we're also able to share that information. So I'll stop sharing. But yeah, thank you for catching that typo.
You're welcome.
Those are much better numbers.
Yes.
Yes.
Thank
Wow.
God.
Yeah.
Thank you for doing that. Thank you for
You're-
doing that.
So
So what,
Chair,
yes, David,
David Young, do we need to make a motion to change that number, or can we just change that number right now?
I think we can do it as a Scribner's error,
Okay,
right? So we will, and the number should be 270. So with everybody's permission, we'll do it as a Scribner's error, so we don't have to wait on this.
Madam Chair, I'm not comfortable doing it as a Scrivener's because 270 isn't included in that number. Can we just do an amendment to change it so that because it's not.
That would be
it's
cleanup,
It's
so-
not close enough. I'm just worried that,
Yeah.
So
Would
I
you like to
don't mean
make
to override okay, sure, I'll make a motion
Okay.
to change the whereas in 2023, there were 270 opioid-related overdose emergency department visits at Kane County facilities and 71 opioid overdose fatalities among Kane County residents.
Thank
I'll
you.
second.
And Mr. Young, second, thank you. Okay, good. So that's a better way to do it. I just didn't want to delay this program, but
Oh.
thank you for bringing those numbers. I was amazed and I thought, wow, but
That's the same thing I
super-
thought. I was like, wow, there's a lot of people.
No.
They must be getting dog bites.
Mosquitoes have like opioid, or something, right?
it's an epidemic. Okay, so now we need to vote on the amendment of changing the number from 230,000 to 270. And so let's vote on that amendment.
Juby,
Should be I.
Genesis,
Genesis, yes.
Carver,
Carver, yes.
Young,
Yes.
Sanchez,
Sure, why not?
Strathman.
Yes. Okay, so the amendment passes. Now let's vote on the resolution. Call the order. Or call the
Juby,
roll.
Should be I.
Genesis,
Genesis, yes.
Carver,
Carver, yes.
Young,
Yes.
Sanchez,
Sanchez, yes.
Strathman.
Yes. Okay, thank you. Okay, I do have a quick question about that. Who provides the, is it the peer? Is there a training program for the peers that do this? And maybe could you tell us a little bit about that?
Oh,
in
yeah,
the program?
that's an excellent question. Thank you. So we are fortunate that Elgin Community College is one of the community colleges in Illinois that does have a program to train peers. So people do not have to go through that program, and there is a state certification they could get. Certainly in this case where Northwestern is hiring the person as their own employee, they have some latitude in terms of skill sets and things that they want. But we are very fortunate that Elgin Community College offers that program. And there's a lot of people that end up doing a lot of really good things who come through that program. So it's people who, again, may have lived experience, but then they go on and get degrees. They may take the hardships that they faced and the struggles that they had in their lives and turn it into something really positive, where they are able to turn around and use that experience to help others. So thank you for bringing that up, because I think that deserves being called out, that Elgin Community College offers that great program.
It's a really great example of paying forward. Really great. Okay, do you have anything else for us today?
No, we'll keep it simple today. Thank you.
Okay, okay. All right, so then we are on to any old business.
Madam Chair,
Yes, Mr. Tarver.
thank you. I just want to bring note to something that was discovered in the chat, because I want to make sure it's part of public comment. Brett did share the numbers with the bites. Cats are 10, dogs are 47, and others are 3. We want to make sure that number's information is included in public comment.
And thank you, so people can actually hear that. So.
Yes,
okay.
ma'am.
I apologize that those were not,
Thank you.
the numbers that were actually in the report were actually for stray animals that bit, not the biters that occurred in the county. That's why I just want to make sure that got corrected. Thank you.
Okay, thank you. Okay. Okay, and like to have a motion to place the reports on file.
Carver
I'll
moves.
make a motion.
Okay, and it's Tarver and Genesis.
Juby.
Okay.
Oh,
All in favor of that, say aye.
Aye.
Okay, no executive session is needed. New business. I think the new business is that next month we will have some additional, one new additional committee member. When Dr. Silva's replacement shows up, she'll be on, he, Mr. or Mrs. Vacant will be on this committee with us next month. So we'll welcome them, and then we'll get you up to date on what we're doing, and it'll all be good. So, and Mr. Gripe, you're welcome to sit in with us anytime. Okay. Okay. So I need a motion and a second to adjourn. Okay, all in favor?
Aye.
Aye.
And happy holidays to you all.
Happy holidays.